Bile is basically a yellow-green fluid produced by the liver and stored in the gallbladder. It mainly consists of bile salts, phospholipids, cholesterol, bilirubin, electrolytes, and water. It plays a key role in the digestion and absorption of fats from the food we eat. Bile deficiency may not just cause problems with digestion, but can also cause abnormal changes in vision, changes in eye color, changes in skin color, and pain in different parts of our body. So in today's video, let's learn about some of the most common signs of bile deficiency so that you can recognize this condition and get yourself treated well in time. We'll also learn what are the causes of bile deficiency and some effective natural remedies to address these issues. So let's begin. Number 1. Frequent constipation. Bile deficiency can cause constipation in many ways. As you may already know, bile is important for breaking down and absorbing fats from the foods we eat. When there's not enough bile, your body may struggle to digest fats efficiently, which can lead to bigger fat particles in your gut. These bigger fat particles can make stools bulkier and make it harder for them to pass through your intestines. Another thing that very few people know is that bile acids also stimulate intestinal movement to some extent. They trigger the release of hormones like motilin, which increase muscle contractions in the intestines, pushing food along the digestive tract. But bile deficiency is not the only cause of constipation or irregular bowel movements. Other factors like low fiber intake, dehydration, underlying medical conditions, and certain medications can also contribute to constipation and weaker bowel movements. In fact, a 2019 study shows that around 20% of patients with chronic constipation had low bile acid levels. Another study published in Hepatology in 2018 reported that up to 40% of patients with primary biliary cholangitis, a liver disease that affects bile production, experience constipation. Bile deficiency can also affect the balance of friendly bacteria in your gut. Studies show that bile acids act as signaling molecules, influencing the growth and activity of different bacterial species. So when there's a shortage of bile, it can alter the balance of the gut microbiome, causing gastrointestinal issues like constipation. Number 2. Bloating and indigestion. As explained earlier, bile acids can affect the balance of gut bacteria. So bile deficiency can promote the growth of gas-producing bacteria, leading to gas and bloating. This altered gut flora can also affect digestion by producing enzymes that interfere with proper food breakdown, leading to indigestion symptoms like heartburn and belching. Bile acids play a role in intestinal movement. Inconsistent or sluggish intestinal contractions due to bile deficiency can cause food to remain in the digestive tract for longer, leading to bloating and discomfort. Number 3. Greasy, pale, or floating stools. Bile acids give stools their characteristic brownish color due to the breakdown product called bilirubin. Without sufficient bile, bilirubin breakdown is hampered, leading to lighter-colored stools ranging from clay-like to whitish. Bile acids help emulsify fats, making them easier to digest and absorb. If there's not enough bile, fat molecules remain intact, causing stools to appear oily or shiny. This undigested fat trapped in the stool can also act like air bubbles, making stools float. Number 4. Jaundice. Bilirubin is a yellow-orange pigment that forms as a byproduct of the breakdown of heme, a molecule found in red blood cells that carries oxygen. It usually leaves our body through the digestive system as part of bile. So bile indirectly helps to keep bilirubin levels normal. But if there's not enough bile, the amount of bilirubin can increase in the blood, causing jaundice and showing up as yellowing of skin and eyes. Jaundice can also happen due to liver dysfunction, so if you are noticing the color of your skin and eyes turning yellow, consult your doctor right away. Number 5. Right shoulder pain. Bile deficiency can surprisingly lead to right shoulder pain. It can happen when bile becomes thick and clogs the bile ducts between the liver and gallbladder, putting pressure on the phrenic nerve, which can cause pain in the muscles around the right shoulder blade. Another possible reason is that severe bile duct blockage can sometimes inflame the pancreas, causing a condition called pancreatitis. Pancreatitis can cause intense pain radiating from the upper abdomen to the back and right shoulder. While less common, pancreatitis can also cause pain in the left shoulder. However, Its association with right shoulder pain is stronger due to the anatomical layout of the pancreas and its proximity to the right diaphragm, which shares nerve pathways with the right shoulder. Number 6. Dry eyes and skin. Bile is essential for the absorption of fats and fat-soluble vitamins. Severe and chronic bile deficiency can lead to malabsorption of fat-soluble vitamins like vitamin A, which is essential for maintaining healthy skin and mucous membranes, including those in the eyes. This can contribute to dryness in the eyes in some cases. This vitamin A deficiency can also cause dryness of skin, causing wrinkles and loss of skin elasticity, and sometimes dermatological conditions like xerosis that usually affects arms, legs, and trunk. But it's very uncommon and can also happen due to many other reasons other than bile deficiency. But if that's happening to you too, especially with other signs of bile deficiency, consult your doctor right away. Number 7. Abdominal pain. Bile deficiency can also cause belly pain and stomach cramps, because as mentioned before, bile helps to digest fat particles in the food. When there's not enough bile, your tummy might struggle to break down fatty foods, and this can upset your stomach. Also, bile helps keep things moving smoothly in your digestive system. Without enough bile, stools can get stuck inside your intestines, causing discomfort and cramps in your tummy. Number 8. Diarrhea. It happens when bile flow is obstructed due to gallstones, inflammation, or other factors so that bile acids don't reach the small intestine in sufficient amounts. Unabsorbed bile acids enter the large intestine, where they attract water and electrolytes. This increased water content in the colon leads to watery diarrhea. Now, bile deficiency, also known as cholestasis, can arise from various factors affecting bile formation or flow. It can happen due to gallstones, inflammation of bile ducts, and sometimes inflammation of the liver due to hepatitis or other liver infections. Certain medications, such as some cholesterol-lowering drugs or antibiotics, can have side effects that impact bile production or flow. In some rare cases, inherited disorders or tumors affecting the liver or bile ducts too can cause bile deficiency. If you're experiencing symptoms suggestive of bile deficiency, like abdominal pain, nausea, pale stools, or dark urine, consulting a doctor for a proper diagnosis is crucial. They can perform tests like blood tests, ultrasound scans, or HIDA scans to determine the underlying cause and recommend the appropriate treatment. Some dietary adjustments and lifestyle changes can help to enhance bile production. Consider incorporating foods rich in healthy fats, such as avocados, salmon, and nuts, into your diet. These foods provide essential fatty acids that can act as building blocks for bile synthesis in the liver, ensuring both quality and quantity of bile acids. You can also consider taking ox bile. It is typically sold as a supplement in capsule or powdered form, and can help to address many digestive issues associated with bile deficiency, like indigestion, bloating, constipation, heartburn, and others. But do not take bile supplements without the advice of your healthcare expert. Identifying the underlying cause and receiving proper treatment is crucial for a permanent solution to bile deficiency. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.